For decades, the brightest minds in cellular biology looked at this tiny microscopic envelope in our bodies and thought it was literally just, cellular garbage, like literal waste. But today, luxury clinics are charging thousands of dollars to inject that same garbage to completely rewrite the rules of female intimate health.
Yeah, it is a massive paradigm shift. I mean, we are really moving away from just managing symptoms with hormones or, altering anatomy with surgery. We're moving toward instructing the body's own cells to just repair themselves from the inside out.
Welcome to the deep dive. Today, our mission for you is to cut through all the marketing hype of these luxury aesthetic clinics and look at the actual raw clinical cell biology. We want to see if treatments operating under names like ExoFemale are, a medical miracle or just a massive unregulated scam.
Right, and it's a topic that sits right at this crazy intersection of brilliant cellular biology, the booming aesthetics market, and, well, really intense regulatory scrutiny.
Because the claim here is massive. This treatment claims to reverse aging and tissue damage at a cellular level without a single scalpel, using these microscopic biological messengers. But there is a catch. While celebrities and medical tourists are raving about it, regulators and cell biologists are sounding major alarms. Okay, let's unpack this. Before we can even begin to understand how this treats female intimate health, we really have to look at the microscopic workhorses behind the therapy. So what exactly is an exosome?
Yeah, so to understand exosomes, we first need to look at where they actually come from, which is typically mesenchymal stem cells, or MSCs.
MSCs, got it.
Right. And for a little time, the holy grail of regenerative medicine was the stem cell itself. Researchers thought, okay, if you have damaged tissue, you just drop in some stem cells and they magically transform into the tissue you need.
Right, like they become the new tissue.
Exactly. But we've recently discovered that stem cells don't primarily work by transforming. They actually act a lot more like cellular commanders. They send out these chemical signals to the surrounding tissues, basically telling the existing local cells what to do. And exosomes are those signals.
Oh, wow. Okay.
Physically, they are tiny extracellular vesicles. And when I say tiny, I mean 30 to 150 nanometers in size.
Wait, nanometers?
Yeah, to put that in perspective, they are about 1,000 times smaller than a single red blood cell.
1,000 times smaller. That is, it's almost hard to wrap your head around. So if a stem cell is a factory, the exosome is like a microscopic package leaving the factory. What is actually inside that package?
Well, they're essentially cargo ships carrying a highly specific payload of bioactive molecules. Inside that tiny envelope, you have proteins, lipids, messenger RNA, and cytokines. And what's fascinating here is that for decades, researchers observed cells releasing these tiny vesicles into the extracellular space and just assumed it was simply a mechanism for cellular waste disposal.
You're kidding.
No, they genuinely thought the cell was just taking out the trash.
I love that so much. The scientific community was looking at the most sophisticated communication network in the entire human body and thought it was a dumpster.
Yeah, it wasn't until relatively recently that we realized these aren't garbage bags at all. They are highly targeted communication systems. They travel through the fluid between cells, find their specific target cells, dock with them, and then deliver this really complex set of instructions.
So it's like a microscopic delivery driver, or actually even better, it's like a tiny biological USB drive.
Ooh, I like that.
Right. It just docks with an aging or damaged cell, drops in a new instruction manual, and tells that cell, hey, wake up, start producing collagen, reduce inflammation, start repairing.
That is a perfect analogy.
Okay.
And, that USB drive analogy highlights the most crucial difference between exosome therapy and traditional stem cell therapy.
Wait, let me make sure I understand that part. Because when people hear regenerative medicine, I think they immediately jump to stem cell injections. How is injecting an exosome different from injecting a stem cell?
Well, traditional stem cell therapy involves injecting actual living cells into the patient's body. The hope is that they will integrate and survive. But introducing living foreign cells carries some really significant risks.
Because they're alive.
Exactly. Because they are alive, they can provoke a massive immune response, or they can behave totally unpredictably. They have a nucleus, meaning they can replicate, and sometimes they replicate into the wrong type of tissue entirely.
Oh, yikes. Yeah, that's not what you want.
Right. Exosome therapy, on the other hand, isolates just the communication system. You are harnessing the regenerative signals of stem cells without introducing any living cells into the body. Because exosomes are acellular, meaning they have no nucleus and absolutely no ability to replicate on their own, they are theoretically much safer and far less likely to provoke an immune reaction.
So wait, if they have no nucleus, they can't mutate like a rogue stem cell could. That complete changes the risk profile. So what does this all mean for the patient? I mean, we've established that these biological USB drives exist, but what specific instructions are they delivering to female intimate tissues? Are we just talking about cosmetic rejuvenation, like a superficial fix, or is there a real medical application here?
Oh, it is profoundly medical. To understand the medical application, we really need to talk about genitourinary syndrome of menopause, or GSM.
Yeah, looking at the British Menopause Society data in our sources, I was honestly shocked by how fundamental this shift is. It's not just discomfort. The healthy bacteria literally die off. It's like a complete ecological collapse in the tissue.
That is the perfect way to describe it. GSM is this comprehensive term that covers the vulvovaginal and lower urinary tract symptoms that occur when a woman's estrogen levels drop. In a healthy premenopausal state, estrogen supports a thick vaginal mucosa, good blood flow, and a low acidic pH that prevents infection.
It sounds like estrogen is basically the architect of that entire environment.
Yes, exactly. And when estrogen drops during menopause, the architect leaves the building site and the whole building just collapses. The mucosa thins out dramatically. There's a significant reduction in the cells that release glycogen, which starves the healthy bacteria.
Wow.
And then the pH rises, making the area prone to infections. It leads to severe dryness, loss of elasticity, microscopic tearing, and just chronic pain.
And the traditional treatment for this has been localized hormone replacement, right? Like estrogen creams or pessaries. To use the analogy, you're just trying to coax the architect back to the site. But how do exosomes possibly reverse an ecological collapse like that without using hormones?
Well, ExoFemale and similar therapies approach this from an entirely different angle. They don't replace the estrogen at all. They provide an entirely new set of blueprints directly to the construction workers.
Oh, I see.
Yeah, they use adipose-derived MSC exosomes, meaning exosomes harvested from fat-derived stem cells to intervene at the cellular level. When these exosomes are applied to the thinning, damaged tissue, they deploy their cargo. First, they transfer pro-angiogenic factors like VEGF, which is vascular endothelial growth factor.
Which literally tells the body to build new blood vessels.
Exactly. More blood vessels mean more oxygen and nutrients are delivered to the starved tissue, which immediately improves its health and natural lubrication. Second, the exosomes target and stimulate fibroblasts.
The construction workers.
Right, the cellular construction workers responsible for producing collagen and elastin. In GSM, without estrogen, these cells have basically gone completely dormant. The exosomes wake them up, leading to a structural rejuvenation of the vaginal wall, restoring its thickness and elasticity.
The sources also mention an anti-inflammatory component, which I thought was interesting. They talked about the exosomes transferring antioxidant molecules, specifically things like superoxide dismutase, or SOD, and glutathione peroxidase. When I first read that, it sounded like a chemistry textbook. What are those actually doing in the body?
Think of oxidative stress as microscopic cellular rust.
Mm-hmm.
When tissue is damaged or aging, it accumulates this rust, which causes chronic inflammation and actively prevents healing.
Okay.
Molecules like SOD acts as a microscopic rust remover. They neutralize that oxidative stress and suppress the chronic inflammation, creating a much healthier, pristine tissue environment overall.
It's incredible. You're not just masking the pain or adding an artificial lubricant. You're fundamentally altering the tissue architecture from the inside out. And looking at the target audience for this, it's incredibly broad. The clinics aren't just utilizing this for postmenopausal women dealing with GSM. They're treating postpartum women who are dealing with tissue laxity and reduced sensation after childbirth.
Yeah, because the biological mechanisms, collagen synthesis, angiogenesis, tissue repair, they apply to traumatic tissue stretching just as much as they do to estrogen-deprived tissue. The exosomes don't care why the tissue is damaged. They just deliver the instructions to repair it.
I noticed the sources also highlight women suffering from stress urinary incontinence, which is when you leak a little during a cough, a sneeze, or a laugh. And even more surprisingly, they're using it for chronic, notoriously difficult conditions like vulvar lichen sclerosis, where traditional steroid creams often fail completely.
Yeah, lichen sclerosis is a really fascinating application here. It's an autoimmune-related condition that causes severe itching, pain, and scarring. The immunomodulatory effects of the exosomes, basically their ability to actually calm down a hyperactive localized immune response, seem to break that cycle of relentless inflammation where steroids just can't.
Which makes me wonder, how is this actually administered to a patient? If we have this miraculous biological solution, what does the patient experience look like? Because for anyone listening who is terrified of surgery or long recovery times, this is where it gets highly appealing.
It is entirely outpatient, and it is completely non-surgical. The exosomes come in a purified solution, which
Yep.
is usually kept frozen at extremely low temperatures until right before it is used, just to preserve those fragile mRNA
Makes
instructions.
sense.
Depending on the patient's specific needs, it's administered either via a topical application, often following a microneedling process to allow the nanoparticles to penetrate the skin barrier, or through minimally invasive microinjections directly into the vaginal or vulvar tissue.
And there's basically zero downtime. You walk in, have the procedure, and go about your day. But what I found so interesting in our research is that clinics rarely just inject exosomes on their own. They almost always use them as a supercharger alongside other therapies. Why is that?
It comes down to creating a receptive environment for the exosomes. Combo therapies are becoming the absolute gold standard in regenerative aesthetics right now. The philosophy is you create a controlled injury or intense stimulation, and then use the exosomes to accelerate and optimize the healing process.
Like prepping the soil before you plant seeds.
Exactly. For instance, clinics often combine exosome application with fractional CO2 lasers or radiofrequency microneedling like Morpheus 8.
So the laser or the radio frequency creates microchannels and heat damage in the tissue. It's basically sounding the cellular alarm bells, telling the body, hey, we are injured, send help. And then you flood that exact area with these exosome USB drives packed with regenerative signals.
That's the exact cellular cascade. The heat damage initiates the body's natural healing response, but the exosomes come in and dictate how the body heals. It ensures it builds high-quality collagen and new blood vessels, rather than just forming scar tissue.
And then there's the BTL Emsella chair, which sounds like something out of a futuristic gym. The patient literally just sits fully clothed on this specialized chair, and high-intensity focused electromagnetic energy triggers thousands of supramaximal pelvic floor contractions in 30 minutes.
It's wild.
It's the equivalent of doing thousands of Kegels effortlessly. And clinics are pairing that muscle-building technology with the tissue-repairing power of exosomes.
It's a highly effective two-pronged approach. The chair builds the actual pelvic floor musculature, treating the structural cause of stress incontinence from the bottom up, while the exosomes repair the mucosal tissue, the collagen, and the nerve signaling from the top down.
But of course, this level of cutting-edge science does not come cheap. Looking at the global market, we see a massive boom, particularly in South Korea, which has established itself as an absolute powerhouse in regenerative medicine and stem cell biotechnology. According to the brochures aimed at medical tourists, a single exosome treatment in the Gangnam district can run anywhere from $1,100 to $2,100 US.
Yeah, it's a major investment.
And if you want that combo effect, say exosomes plus PRP, which is platelet-rich plasma, you're looking at up to $300 and $700.
The clinics there are highly specialized, and that price tag really reflects the premium positioning of human-derived stem cell products.
But wait, if you look at the UK market in our sources, clinics are offering exosome sessions for around £350. Does that massive price discrepancy mean the UK version is just heavily diluted? Or are we talking about a fundamentally different product? Because if you can just walk into a clinic in London and pay £350 for the same thing that costs nearly $4,000 in Seoul, someone's rules are being broken here. What are they actually injecting into people?
Yeah, this raises an important question, and it is really the crux of the whole controversy. That price discrepancy is your first major clue that the landscape of exosome therapy is not uniform at all.
Here's where it gets really interesting, because exploring the current market for exosomes is like paying for a highly trained construction crew to rebuild your house, but the contractor actually just brings in a truckload of cabbage. Yeah, sure, the cabbage is organic, but it doesn't know how to build a wall. It is the definition of a Wild West out there.
That analogy, bizarre as it sounds, is remarkably accurate when you look at the regulatory landscape and what is actually legally allowed. The underlying science of exosomes holds incredible, undeniable promise, but regulatory bodies, like the FDA in the US and the MHRA in the UK, prioritize safety above all else.
Right.
Currently, multiple exosome-based therapeutics are in Phase 1 and Phase 2 clinical trials under FDA investigational new drug authorizations.
Meaning they are strictly for research right now. There is no approved exosome therapeutic for aesthetic or cosmetic use anywhere in the US.
Correct. The approval process for biologics, which is the category human-derived exosomes fall into, is incredibly lengthy and rigorous.
But if patients are paying $3,700 in South Korea and seeing these amazing life-changing results for GSM and incontinence, isn't the FDA just being overly bureaucratic? Why not let people take the risk if the science is sound?
Well, because the risk of unpurified human biologics is catastrophic. Anytime you take biological material from one human being, like stem cells from umbilical cord, blood, or fat tissue, and process it to put into another human being, there's a severe non-negotiable risk of disease transmission.
Oh, wow.
Yeah, if that material is not strictly regulated, rigorously screened for pathogens, and perfectly purified, you aren't just transferring healing signals, you could be transferring blood-borne diseases.
That brings us to the brilliant investigative journalism from The Guardian in the UK that we reviewed. They exposed a massive gray area in how clinics are operating to get around these safety laws.
Right. Because human biologics are so tightly restricted legally in places like the UK, clinics are only allowed to use exosome products derived from plant cells or from animal sources for cosmetics. For example, there's a booming legal market for polynucleotides derived from salmon sperm DNA or exosomes extracted from things like red cabbage or roses.
Salmon DNA and cabbage. That is the truckload of cabbage I was talking about. It's not exactly the human stem cell magic that patients think they're paying for when they see the word exosome on a glossy brochure.
No, not at all. Plant and animal derivatives might have some mild, generalized anti-inflammatory properties, but they do not contain the specific human cellular signaling factors, the VEGF, the specific cytokines that a human mesenchymal stem cell exosome does. The cabbage exosome cannot instruct a human fibroblast to build collagen. It doesn't speak the same biological language.
So a patient pays 350 pounds, gets injected with rose or salmon exosomes, and maybe gets a little hydration, but definitely not the cellular rewrite they were promised. But the investigation found something even more alarming than false advertising, didn't it?
It did, yeah. The investigation found that some luxury clinics are bypassing the rules entirely and illegally importing and using banned biological products. To give their clients the dramatic results they promise, they're quietly using formulations derived from human umbilical cord blood or human stem cells, completely outside of the regulatory safety net.
Which means there is no way for the average patient to know if the vial the clinician is holding came from a highly regulated, sterile, multi-million-dollar laboratory, or if it was just ordered off the gray market with zero quality control.
Exactly.
Dr. James Edgar, a cell biologist at the University of Cambridge, was quoted in the investigation, and his reaction was incredibly sobering. He basically said, "I'm really appalled and shocked. These are human biologics, and there's a risk for disease transmission. It's not in the public's interest of safety to have this stuff watching around."
If we connect this to the bigger picture, what we are witnessing is the classic tension in medical innovation. The basic science of regenerative medicine is advancing at breakneck speed. The clinical results in controlled settings are genuinely astounding. But that science is vastly outpacing the regulatory safety frameworks required to protect the public.
Yeah, the demand is just too high.
Right, the demand for anti-aging, non-surgical, non-hormonal solutions is so high that a gray market inevitably fills the void left by the slow, necessary pace of clinical trials.
So, to wrap this all up for you listening, ExoFemale and the broader world of intimate exosome therapies represent what could be a massive historical leap forward in regenerative medicine. We are talking about a non-hormonal, non-surgical way to heal and rejuvenate tissue at the cellular level. It offers real fundamental relief for genitourinary syndrome of menopause, postpartum recovery, and autoimmune conditions like lichen sclerosis that have historically been very difficult to treat.
The biology is fundamentally sound, and the potential to restore a woman's quality of life, to rebuild that tissue architecture without the risks of surgery or systemic hormones, is extraordinary.
But as a consumer, you have to be incredibly vigilant. You are navigating a true Wild West market right now. Whether you are a medical professional looking into these therapies, someone navigating the physical changes of menopause, or just insanely curious about the future of anti-aging, the most important takeaway is this: you must interrogate the source. Always ask your practitioner about the exact origin, the brand, and the legal status of the injectables they're using. If they tell you it's a human stem cell exosome but can't produce the rigorous safety and sourcing documentation, or if they claim a plant exosome is going to magically regrow human blood vessels, walk away.
Which leaves us with a final, somewhat provocative thought to consider. We've talked about the risks of using human donors to get these exosomes. But if exosomes are, at their core, simply empty biological envelopes that carry a payload of genetic instructions, could the future of this therapy bypass human donors entirely?
Oh, that's interesting.
Imagine a near future where we don't need to harvest stem cells from umbilical cords or fat tissue, completely eliminating the gray market. Imagine a world where we can synthetically manufacture these nanoscale lipid envelopes in a lab and program them with custom-coded mRNA. We could effectively create a programmable software update for the human body, tailored to heal specific tissues, that carries absolutely zero risk of human disease transmission.
A completely synthetic, risk-free biological USB drive. We might eventually get our microscopic fountain of youth without having to worry if there's a biological Trojan horse hiding inside. Thank you for joining us on this deep dive. Until next time.